Hi, welcome to the Denver Older Adult Helpers channel by Maintain Me. I am Morgan with Maintain Me, and today we have a very special guest. I'm going to let her introduce herself.
Good morning. My name's Sara Stind. I'm a patient resource manager with Elevation Hospice.
Excellent, Sarah. Thank you so much for being here today. And if you are watching, give us a like, hit that subscribe button, stay up to date on all the videos we're doing, about one a week. And even better, we love to hear from you. Give us your comment. If you have a question on today's video or even a question for Sarah, put that in the chat down there and we will make sure we answer it on an upcoming video, whether it be a short or one of our recordings. So I love to have you here. Thanks for watching. And without further ado, Sarah is going to be telling us about 3 top hospice myths. That's right, myths. People think something's true about hospice, but Sarah is here to clear that up for us today. Sarah, take it away.
Thanks, Morgan. There are so many myths surrounding hospice care in the United States, and I just feel really fortunate that I get to be part of this conversation. The number one myth I hear is that hospice is essentially giving up on your loved one.
Mm.
Um, that's not the case. People put a lot of faith in the medical community to fix all of our problems. And eventually, everybody's time does come, and these treatments and medications and procedures can be more burdensome on a person. So it really is an act of love, and it's not giving up. It's taking a look at your loved one and what their quality of life is like and relieving them from pain and suffering. So, on the contrary, it's a very loving act, but it's just shifting that perspective from sort of fixing what's not fixable to focusing on making a person feel as good as they can at the end of their life.
And I think that's really positive. I mean, what a gift, really, and highlighting that it isn't giving up, but more focusing on compassion and love. What about people deciding for themselves? You mentioned someone making a decision for a loved one, I would presume in a power of attorney situation, but what if, um, what would you say to someone who's maybe facing that themselves?
Yeah, absolutely. And that's a great point. It doesn't always have to be a decision that you're making for a loved one, it could be for yourself. And sometimes we find that our patients feel guilt about that, where they feel that they don't want to let their partner down. We often see that in couples that have been married for quite a long time, where they say, "Well, my wife, you know, she wants me to go through this aggressive treatment, and I don't want to let her down."
Mhm.
Um, I always just encourage people to get it out in the open. We're really afraid to have these types of conversations in our society, because we think that we are eternal. And, the fact of the matter is, everybody is going to die, and we're afraid to acknowledge that. And I just love having conversations with people and kind of getting them more comfortable with just talking about this idea of death. And a lot of times when I do, people go from being very, very stressed and uptight to kind of you can actually see their guard coming down. And
Mm.
it's just about getting those feelings out into the open about your fears.
Yeah, excellent point, Sarah. Thank you. And I think that may be someplace where somebody, in the audience there wants to chime in too. Give us your story. Tell us what your families maybe experienced or what your questions are. Thank you, Sarah. What about number 2?
So number two would be hospice is a place. A lot of people say, my grandma is going to be going to hospice. Well, hospice is a concept, and it's really a team of people and a support system that travels to wherever you or your loved one are. So most patients actually in the United States are cared for in their homes. A home can be a private residence, it can be a retirement community,
Mm.
it can be assisted living, skilled nursing. There are also hospice inpatient facilities, and those are really designed for short term symptom management, rather than a long term solution. But hospice can
Wow.
travel anywhere. Hospice even services the homeless population. So the idea that hospice is a place is a big myth, and it really creates a lot of flexibility for that patient and family as far as where they want to receive care.
Well, that's excellent. I know peace of mind would be being able to pass away in your own home or where you call home. So
Mhm.
that's excellent. Yeah. So then if someone, you said going to hospice is really more of a short-term solution. What, help me explain or help me understand that a little bit better.
Yeah, so there are hospice inpatient facilities. The
Hmm.
requirement for those is that they are staffed by licensed nurses 24/7. And that's for that relief of pain and symptom management. So if a person is, let's say, living in their own home and they have their pain is not being controlled, there's been different regimens that have been tried to alleviate their pain and nothing's working. They could potentially go to an inpatient center and receive around the clock care until their symptom is better managed. After that period of time, it can be days to possibly weeks, but it's usually on the shorter side. They
Mm.
would return back to their home. Sometimes people do end up spending the last few remaining days at those facilities, but there just has to be a medical justification. The other utilization for a hospice inpatient unit is for respite care. That is a 5 day at a time benefit for caregiver relief. So there does not need to be a medical qualifier for respite care. And respite care can also be in a skilled nursing facility. Um, we are able to follow our patients from home into licensed facilities for those respite stays and continue to bring the same team to care for them, but then have that 24-hour support because hospice does not provide 24/7 care. We are an extra layer of care for the primary caregiver or the staff at a care facility.
Interesting. I think, I definitely hear that all the time about hospice. So, very good point. Does that kind of lead you into number three?
Yeah, so I would say these are sort of two lumped into one.
Okay.
But a lot of people think hospice is for the last days of somebody's life. And
Mm.
also, if they elect to go on hospice, it's going to hasten a person's death. That could not be farther from the truth. Hospice is a 6-month benefit. When I say that, it means that two physicians have to determine that a person has a prognosis of 6 months or less.
Mm.
There are certification periods along the way that could allow a person to stay on longer. So if a person's on for 6 months and they're still meeting those criteria of that 6 months or less, theoretically they can be on longer. So we have seen people that have been on for longer than 6 months and up to a couple of years.
Oh,
Um, and as far as the hastening death, that is not true. Sometimes less is more when it comes to treatments and medicine. The less sometimes that a person is taking and undergoing in kind of unnecessary procedures, sometimes they feel better. So we have seen folks that when they have extra care, fewer medications to manage, they actually start to improve. And I'm not saying that to be misleading. It's just that is one of the bigger myths. And it sometimes surprises patients and families that they say, wow, now that mom is not on 20 medications, her appetite has gone up. She has more energy and she's starting to thrive a little bit.
wow.
Um, and then with that, with I'll kind of tie this together. I would say the earlier the better to talk to a hospice agency. Often we get referrals so late, and it's really, really hard to make a good impact on a person's life in just a couple days. So the
Sure.
earlier that these conversations can be had, and the sooner hospice can get involved, the better experience for everybody. And usually that's what people tell us is that we wish we would have done this sooner. So I'll
Mm.
leave it with that.
Yeah. Well, so that actually leads me to a question is if somebody is considering hospice or hospice has been mentioned and maybe you decide to go forward with it, what does a person do? Say I didn't work in the field and I was at home and I needed hospice. How would I initiate that for myself?
There's a lot of different ways. A lot of people will go on Google, and you can search for hospices in your area that way. You can also check Medicare.gov, and you can pull up a list of hospice agencies in your area, and they will be rated with star ratings to show you that you can compare quality of different agencies. I would also recommend talking to your physician. That could be a primary care physician, that could be an oncologist, it can pretty much be anybody, and really anyone in your circle. There are a lot of people involved in senior care and healthcare, and maybe your neighbor has had a personal experience with their relative and they can recommend a hospice agency. And I'd always recommend talking to a couple and then doing your research.
So that would be your first step is say I get on Medicare.gov, I pick two according to their star ratings. They have, say 4 or 5 stars. I don't know, does anybody even have 5 stars? But
No.
4 or 5 stars, and so I've narrowed it down to two. Is my next step to call those hospices personally, or what would I do after I've picked out my two that I want to shop, basically?
Sure, and I would consider that just one of your tools. I wouldn't say to always just narrow it down by two by looking at that list, but I would get a gauge of the overall quality because in a big area like the Denver metro area, some might be stronger in certain areas and not as strong in other areas. And you want to make sure that your particular agency has good coverage and good staffing and a good solid camaraderie with their local community too. So I would just use that as a tool. And then I would really talk to your healthcare providers about what that looks like. They will be the ones to initiate the referral and
Okay.
get you. You can also pick up the phone and just call. And we get a lot of phone calls at our local office in Arvada of people that just Googled us.
Yeah.
You can do that as well, but to really get the referral going, that will have to come from your primary care physician or your care facility, and they can work with your providers to get that generated too. And just, I would say, feel it out. Ask a lot of questions, ask what they're able to provide, meet one on one with a liaison if you have the opportunity to do that.
Yeah, that's great advice. Great advice. Is that what you do as a patient representative? Do you go and meet with people who make those phone calls?
Yes, yes. So I work with referral sources in the community. And then once that referral is obtained, I contact the patient or family and we arrange for a meeting where we talk through their particular situation, their concerns, their questions. And then I assist with getting them enrolled ultimately and all the details that go along with that. Arranging for equipment in the home, making sure it's a safe home environment,
Mm,
and kind of help with the onboarding, so to speak.
gotcha. Very cool. Well, I bet your patients are very happy to see you when you come.
Thanks,
Um,
Morgan.
yeah, you're
I hope
welcome.
so.
Yeah. Well, I just think this has been so valuable. Some things I learned even being in the industry. So thank you for being here,
Thank
Sarah.
you for
And
having me. I
thanks.
appreciate it.
Yeah. Thank you to Elevation Hospice for allowing us to steal a little bit of your time. And thank you out there in YouTube land for watching and following along. And we hope to see you another time. Have a great day.
Thanks, everybody.